Hey everybody, welcome back. All right, so this time what we want to take a look at is the endocrine system, and this time we're going a little deeper, and we're talking about the thyroid gland, and we want to discuss it from a standpoint of when you have problems with your thyroid gland, whether it's overactive or underactive. Really critical to know, and we have to go deeper on this because this is something that tends to always show up on the NCLEX, okay? Always, 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 right? And we'll also get a little deeper in how to treat some of this. Okie dokie. So, here we go. All right, so what are we doing at Arncliffe Notes? As we say, right? Helping students to see through larger concepts with what? Study smart strategies. Got to have them, okay? All right, next up. So we're numbering our paper, our device, from 1 to 8. All right, we'll have 8 questions kind of threaded throughout this presentation, right? We like to quiz you along the way. Okay, so number 1, the very first one. Now we're reflecting on our anatomy and physiology video that we just did. And as we're looking at that, so we want you to provide a number sequence that identifies the following structures in order. Okay, so the adrenal, thymus, and pancreas. So we want you to find those numbers and put them in that order. And by the way, just a little play here. So we've got ATP, adrenal, thymus, pancreas. Ready? Here we go. So there it is. So we're identifying each of the following: adrenal, thymus, and pancreas. Go ahead and jot that down. Okay, and you should come up with a sequence of numbers. And pause the video if you need to. Here we go. All right, this is the number sequence you should have come up with. 9, 4, and 5. So 9, the adrenals, right? 4, the thymus, which we said in the previous video is, what do we call this area again? Mediastinum, right? Right here behind your sternum, okay? And then 5, your pancreas, going to transverse across your abdomen there. Okay, good. Now, just to highlight those for you, okay, and now, number 2. In the previous section, we said thyroid did something. What did your thyroid handle specifically? So write that down as number 2 if you remember. Really important that you understand this. Okay? And that answer should be metabolism. Your thyroid handles metabolism. Absolutely. Okay? So this is going to play a critical role in terms of our assessment, because as we look at metabolism, it's going to have a direct impact on our patient's signs and symptoms, right? I mean, even down to their body type. Okay? So, right. Now, this is the way I like to set things up. I think it really helps to enhance your understanding if we go ahead and split those 2 disorders and look at them side by side. If you don't do that, you find yourself like confusing things, right? Okay, so we take the hormone, stick it in the middle, and we look at the hormone, what happens when the hormone level is too high, and we look at what happens when the hormone level is too low. Okay, so when the hormone level is too high, when we're talking about thyroidism, all right, so hyperthyroidism, we see enlargement of the thyroid gland, which we also refer to as a goiter. Special note about that goiter situation, and this is the part where NCLEX and examinations tend to go in on the most, right? So that goiter, an enlarged thyroid gland, okay? It's very important that we don't palpate that. I mean, you want to palpate it as you're looking at it like, wow, what's going on with my patient? So let me palpate that and see what's going on. But here's what you need to realize. Every time you palpate or squeeze that thyroid, I want you to think of it like almost like an orange or a grapefruit that doesn't have the skin on it anymore, right? So it's peeled. And every time you touch that and palpate it, what happens? Some of the juice comes out of it. Well, now you need to also realize that that juice, right, that what you're secreting, what you haven't forcing that gland to secrete that juice is actually hormone. So you're boosting that patient's hormone levels, and that could be really dangerous, as we're going to discuss in this video, right? Really dangerous. So what we don't need is every member of the team coming in and palpating that and what? Overdosing our client on their own hormone levels. Okay? Keep that in mind. Now, okay, so enlargement of the thyroid, goiter, bulging eyes, exophthalmos. Now, while we use the late, great Don Knotts for this, I cannot confirm for sure that he suffered from this condition. But he just has that appearance, right? Okay, so rapid and irregular heartbeat or palpitations. Now, as these flow, I want you to pay attention to the flow of the symptoms the way I set it up, and this will help you to remember it. Okay, so we've got the key identifiers right there, right? Enlargement of the thyroid, so they have a goiter, they have the bulging eyes or exophthalmos. But now, watch the flow. So, we got rapid irregular heartbeat. Rapid heartbeat. Now, if you think about that for a moment, it's that rapid heartbeat that contributes to a person feeling anxiety, right? That fluttering in their chest, that's going to make a person what? Anxious and potentially irritable. And if their heart's working harder and they feel anxious and exhausted, what happens? They wind up feeling fatigued, right? And in this heightened state, what else happens? They find themselves perspiring, right? They perspire easy. So they have a heat sensitivity. And with all this work that their body's putting in, there's weight loss, right? Which makes sense because we're speaking about a high metabolism, right? So in this diaphoretic or sweaty state, high metabolism, what do? Lose weight despite them having a normal eating pattern. Yeah. Okay. But we said we wanted to drill down on this and take this to an NCLEX level. So we want to remind you that we want you to picture that as a grapefruit, right? And we're going to come back to that, and what we're going to do is give you a scenario where that grapefruit is peeled except for one side of it, right? So just let that settle in your mind. We're coming back, okay? Now, hypothyroidism. Pay particular attention to the body types of our patients, right? Before, we had a patient picture or a picture up there where the person had a smaller frame. In this instance, the person has a larger frame. Why? Because we're speaking to metabolism, right? So the previous picture, that individual had what? A higher metabolism. This individual has a slower metabolism, right? So hypothyroidism. So we see a puffy face, right? And hoarseness, fatigue, increased sensitivity, this time to cold. See, the previous individual had a sensitivity to heat. This time, with a slower metabolism, they have a sensitivity to cold. They have muscle weakness, constipation, which fits with the muscle weakness. Well, not to forget, right, that in the GI system, our alimentary canal, our GI tract, is lined with muscle. And if we have weakness in our muscles in general, including those muscles, we wind up with constipation because the food boluses aren't moving through at the rate that they should be, right? Okay, so our individual, because of their slow metabolism, they wind up gaining weight. And instead of sweaty, moist skin like the previous individual, they have what? Dry skin. Yeah, right? This is what I'm talking about. Very important to see the contrast between the two. That helps the information sink into your mind, okay? All right. Now, so we stack those up side by side. So now we've got number 3 and number 4 for you. And in this instance, what I want you to do is think about that hyperthyroidism, but let's give it a name. What's the other name for hyperthyroidism, right? So not just a little bit high, you know, in terms of their thyroid level, but significantly high. What name would that get? Then the opposite is true. For hypothyroidism, that gets a specific name when they suffer from hypothyroidism on a prolonged basis. okay? And in the middle of it all, which we hadn't talked about, is euthyroid. Anything referring to the body, generally speaking, means good, right? So your patient could be in a what? Euthymic mood, a good mood, right? Or let's take it even to respirations, right? So you've got tachypnea and bradypnea, but you could also have what? Eupnea, good breathing, right? Good respiration. All right, so when we see EU, something's good about it, okay? So good thyroid level in the middle. Now, so that's 3 and 4, and these are the answers that you should have. All right, so for number 3, it would be Graves' disease. That's right. The other name for hyperthyroidism, taken to another level, they actually will get the formal diagnosis of Graves' disease. And then on the opposite side of things, you can have a client with mixed edema. Now, let's qualify something here so that we can just bring that concept home. You hear this edema, and you want to know, like, okay, so what's mixed about this edema, right? That is the question, essentially. And this is unlike typical edema, where you see a client with pitting edema, right? With all the puffiness that we saw in that client's face before, we'd anticipate that we'd press into that client's edema and we'd see it pit. And for those that don't know, when we say pitting edema, we press our finger into it and remove our finger, and that indentation of our finger remains. That pit stays there longer than it should. For normal people, that pit should not be there. Okay, but now, when we're speaking of edema, and we see that edema, and we fully anticipate we press into that edema, that divot's going to stay there, right? That pit's going to stay there, but it doesn't. That's what's different about mixed edema. It is profound edema that is non-pitting. And it's actually quite impressive when you think about it. So here you're fully expecting it, but no, it does not. Yeah, so it's mixed edema instead. All right, good. So we're going to take this a step further, right? And notice how we're building this out and helping to develop your levels. So first we started with hyperthyroidism. Then we diagnosed it outright, Graves' disease. Now we want you to take it up another notch. When the thyroid level reaches dangerously high levels, what do we call that? Right? Because at that point we're beyond Graves' disease. What do we call that? Then now, on the opposite end, and unfortunately our little line doesn't show up there, right? I guess we can use the bottom of the screen, that's fine, right? So past mixed edema, what will be worse, right? But now, don't forget, we're talking about thyroid, which means we are directly talking about metabolism. So past Graves' disease, somebody's metabolism is what? Through the roof. And I want you to think about the signs and symptoms that would fit with that, right? And on the opposite side, what? Somebody's metabolism is slowing, getting extremely slow, right? So here we go. And for 5 and 6, this is what you should have. All right, so for 5, thyrotoxicosis. Thyrotoxicosis, take that word into your mind. Thyro what? Toxic levels of thyroid. And don't forget, remember we made that comment about your thyroid. For some people, their goiters being like a grapefruit. And what we don't want to do is give them extra doses. This is almost like giving them extra Synthroid tablets, right? Yeah, don't do that. The more you do that, the more you push them towards, right, toxic levels, thyrotoxicosis. Now, let's qualify something here. Because some people will see this word and then they'll see thyroid storm and wonder if they're two different things. They're not. They're the same. Thyrotoxicosis is a different way of saying thyroid storm. That person's in a thyroid storm. What? It's dangerous levels of thyroid, right? So the two ways to refer to that. All right, now, on the opposite end, we have a person going into a coma. Make sure you follow this. Metabolism, to have a metabolism for human beings is survival. Your metabolism cannot go to zero. and you still survive. The human organism has to have an active metabolism to a certain degree. So the more your metabolism slows down, you wind up going into a coma. And lower than a coma, when it gets past those levels and keeps dropping down, then that person dies. So we cannot survive and have our metabolism go to zero, okay? All right, and similarly, on the opposite end, we can have our metabolism go extremely high to dangerous levels, to toxic levels. Why? At some point, our metabolism is so high, it has our heart racing, our blood pressure too high, right? Dangerously high levels. By the way, we said we would address how to treat that. So if we have a client who has dangerously high blood pressure, right? Hypertensive. So they're in hypertensive crisis. And they're also tachycardic, so super fast pulse. What medication would address both of those at the same time? So go ahead and add that to your paper. What medication would address both of those at the same time? And you say what? You should have put down beta blockers. Absolutely. Beta blockers are double duty. That's what makes them so fantastic. They address the hypertension and they slow down the pulse at the same time. So awesome medication when it comes to addressing this. But now, hold on, because we're not done with it yet. Because, okay, so we're fixing the blood pressure, we're fixing the pulse. That's fantastic. But we also have a client who's practically overheating. They're sweating and things like that. Probably a little bit like I'm doing right now. Scary stuff, right? No, it's hot in here. Anyway, so they're really, really warm. And so what can we do about it? So on your paper, write down, what is it that we can do? Are patients sweaty and overheating, right? Okay, so things that you should be writing down. We can put a cooling blanket on them, right? So everybody's seen the kind of bear hugger kind of blankets. Look those up, right? The kind of air blanket that looks like it's kind of floating over your client, right? So that can produce heat or that can produce, you know, a cold effect. And in this case, a cold effect would work fantastically for us. Other things, antipyretics, right? So we say antipyretics, fancy term for, right? Basically meds that are going to bring down the body temperature, bring them out of a febrile state. And of course, probably the best choice in that instance would be Tylenol. Okay, then other things that we can do that are kind of out of the box that you might not think of right away, but we could take IV bags, right, straight out of storage. So that's not something we need to like make any attempt to cool up, you know, cool or anything like that and put it in the refrigerator, none of that stuff. Just take it right out of storage. That's already at like room temperature. And if you took those bags and packed them into the main artery sites, right? So the main arterial sites, put bags here where? In the axillary areas, right? Take 2 more bags, put them in the femoral area. Now what that's going to do is help cool their body down, because as their warm blood goes past these IVs, cool IV bags, it's going to play a significant role in helping their body to cool down in general. Okay? All right, so good stuff, good stuff. All right, now, okay, so we want to reflect back with all this talk about metabolism and see how much you retain from the previous video, right? So we're building here. So try not to skip around if you can help it, you know, to go back and check some things out. So we had T3 and T4, and what I want you to do is identify them on your paper. What was T3 and what was T4? Try to remember our study smart strategy, right? And you should have on your paper or your device, T3, right? What we said last time, triiodothyronine. Triiodothyronine, okay? Then, for T4, we showed you our little special way to remember that one, thyroxine. Yeah. So, these are your 2 primary hormones that get secreted from your thyroid, right? Good. All right. Hey, thanks everybody. Thank you for liking and subscribing, right? Subscribe and join the tribe. Thank you, note takers. We'll see you guys next video.